Imagine you or someone, a loved one, maybe being sick and not able to get the drugs you need. There are patients suffering due to a national shortage of some much-needed cancer medications. Tonight, our Linda Hurtado is taking action for your health on what is in short supply and how that may affect Bay Area patients.
They gave me a break for over 3 months.
James Burns is spending his day at Moffitt Cancer Center getting an infusion of fluorouracil or 5-FU chemotherapy to treat colorectal cancer. He doesn't know how lucky he is. The chemotherapy drug is one of many on the Food and Drug Administration's drug shortage website, where manufacturers can list drugs they've either discontinued or have on back order. Pharmacist Kelly Markey says Moffitt has enough to treat their current patients.
We have not had to turn patients away or do anything as far as decreasing their dosages or anything that would compromise their treatment for their cancer.
But across town at a Pinellas County hospital, Clarence Roast says his adult son Brigham may not be as lucky.
He's in the hospital because he has lymphoma cancer growing throughout his chest. It's under his armpits, up around his neck. Now it's down through his abdomen.
Clarence says his son's doctors are trying to save Brigham's life, but their hands may be tied.
The specific drug called bleomycin is what he wanted to use. We kept waiting for it and waiting for it and waiting for it. And then finally I came to him and I asked him, I said, what's the problem? How come we don't have it? And then he told me that there was a national shortage of it. And I said, are you trying to tell me that my son's dying? And he looked at me and he said, oh, if we don't get the medicines and the medications that we need, yes.
Bleomycin, F5U, and Doxil are among a number of cancer drugs, either on back order or in short supply.
We're continuously monitoring the FDA's notifications as well as other oncology listservs so that we can stay ahead of the information that's being provided.
They also continuously check patients' treatment schedules to see how much of any drug they'll need in the next month. But Markey says some hospitals that don't specialize in cancer treatment, or even smaller offices that do, are having trouble getting drugs.
We'll start from the very beginning.
Clarence, who says his son is just too sick to transfer to Moffitt right now, where bleomycin is available, says he can't believe this can be happening in America. The FDA, who works with manufacturers to address shortages, says, quote, the most common reasons for shortages are manufacturing problems and discontinuations. The most severe shortages we've seen in 2011 involve several oncology drugs and also a shortage of electrolytes. FDA is working with multiple firms on these shortages. But while his son's room remains empty, Clarence wonders if the short supply of some drugs isn't more about old-fashioned greed.
Many people that need health care, such as my son, sometimes don't always get the kind of care that they need or the medication that they need because it comes down to the almighty dollar.
Linda Hurtado, ABC Action News.
The FDA says manufacturers are not required to report shortages, but we've learned potential legislation working through Congress may require manufacturers to report them as they arise and require the FDA to take specific actions to ease drug shortage issues. And we are sad to tell you tonight, the Robust family called us and said their son lost his battle with cancer earlier today. To read more about the cancer drug shortage, you can visit our website at abcactionnews.com.